Hi, in this presentation, I will be going through a healthcare dataset taken from a WHO website, and here we will be comparing different key indicators related to health of around 8 countries around the world, and some of them are Asian, some of them are European and American countries. Yes, okay, let's just go through it. And as I mentioned before, the source I have taken is from the World Health Organization dataset, and I have implemented an API to the fetch the dataset. And the key indicators that I have referenced or that I have included in this in my analysis includes life expectancy at birth. That means the average year a newborn is expected to live, be considering the life expectancy of that country. For example, a child is born in Finland at this period. His life expectancy at birth is around 82 years, means that he is gonna live in average of around 82 years. And IMR meaning like how much children or how much infants dies um, in ratio to the thousand live birth in that specific area at that specific period. And under 5 mortality rate means the probability of dying before the age of 5. And the scope of the dataset means that this dataset contains the data from the period between the year 2000 and 2024. And yes, it contains the data of different countries across the world, and I have just taken a sample of few countries from there. And who can be this, for whom can be this interested to? Maybe it can be interested for health professionals and students, or maybe to statistician, or anyone enthusiastic about health data. And why could this analysis be important? Maybe we can take some insights from there here, and the comparison, and we can know that we can know where we need to work more, or where which country need to where which and need to address. And we can also find the problems around the world prevailing in a specific part of the world. And yes, the goal of this analysis is just to like compare these different indicators or different strengths. Okay, let's just go through the plots and implementation and do the analysis. As I have taken a reference from the WHO dataset, and here's their API. And for this task specific task, I have included these 4 of indicators: probability of dying between the age of 30 to 70 from different non-communicable diseases, and life expectancy at birth, under 5 mortality per thousand live birth, and suicide mortality. Means that dying, how much people in a country die because of the suicide. And also if you are interested, you can also try other different indicators it's mentioned here, or also like other many more that you can find from this link. And yes, for my analysis I have taken I have taken these countries, 8 countries, and 9 countries. And you can also like take many more countries by just finding the country code from here, this link, and just adding it the bottom. And I have done some like data analysis things and plotting things here in my Python implementation. And okay, let's just run this again. Okay. uh, what we can know from the here is like many people in India die because of many people in India aged between 30 to 70 die because of the non-communicable disease, and following are other South Asian countries, Nepal and Bhutan, and it seems that Finland, China is at the top. Like mean that the maybe people die because of other causes or not at this age. China is doing well in the prevention of NCD, and maybe the South Asian countries need to address or need to do something to address NCD. Sorry about this graph is a bit rough, but I have I have a simpler implementation of that graph below, so we can just dive into it later and do the comparison. And as I mentioned before, the life expectancy means how much how much is a kid or a newborn expected to live, given the circumstances or given the average life expectancy of a country. Okay, and similar, the developed countries or European countries seems to be at the top here. uh, by the data, this data shows that the newborn born in Germany is expected to live around 82 years of age, average age, and following is Finland, where it is expected around 81, and and look at Nigeria, the average life expectancy is just above 60, and following these are other countries like India, Brazil, and Nepal. And these charts shows the under 5 mortality at this latest year. Okay, Nigeria needs to work on improving the under 5 mortality rate. Yes, under 5 mortality rates include the death of infants, and infants are the children below 5 years of age. Okay, Finland is doing quite well here also, but the situation in Nigeria seems to be worse. Yes, they can take a reference from it and do something to improve these problems in these specific countries. Yes, also from this trend we can see that the pink one. Okay, maybe Nepal. Yes, it was like worse in the year 1960, around 1960, and yes, it has done a substantial work, bringing this below to around around 20, just around between 25 to 26, around 25 to 26 by 2024. And yes, and other countries, maybe this black one, I don't know, and this must be Nigeria. Yes, still Nigeria needs to work upon it. And okay, this chart is interesting. Look, okay, we can know from the here is like the suicide mortality rate in Finland is so high, and it is least in India. Okay, so we can understand that around 24 people per 100,000 person, 24 people in Finland died because of doing suicide. And also following that is the United States and Germany, but it is least in India, which is just around 17. Yes, this is the simpler uh, chart for the probability of dying between the age of 30 and 70 because of different non-communicable disease. Non-communicable disease means the disease that cannot be transmitted from one person to another person. For example, these are like um, long-term disease or chronic disease. For example, it can also be chronic or it can be acute. For example, the short-term or long-term. And non-communicable disease, mostly the people die because of hypertension or other heart disease, diabetes. These are the non-communicable disease, and we can see the trend here. Yes, because of the advancement in the healthcare, every country seems to be doing well in controlling the death of NCD between these age. Yes, still I think Nepal needs to address this, and also somehow India, US has done a good job following. Yes, also the Norway and Germany have done a great, and okay, China is the top of them. Yes, has done a great job. Also, the Brazil, every country, most of the countries, developed countries have done a good job, and maybe Nepal, Nigeria, and other countries need to address this. Okay, this chart shows the average life expectancy at birth, and the three dot here denotes the top of the upper one denotes the average life expectancy of female, the bottom one is for the male, and the between one is the average among the male and female. So here is three, and also we can know that the average life expectancy is more for the female than male, so that means that female tends to live longer than a male. Yes, and this one shows just the average or the between one. So yes, we can see that the expectancy around the world has been improving across this decade, and this could be because of the advancement in healthcare facilities and technologies, and also we can note that the yes life expectancy decreased the in this period around 2019 to 2021. This can be because of the COVID-19 pandemic that caused um, that caused death of many people around the world. Yeah, it must be because of that. And we can note from this chart is that Brazil suffered a lot, and following them are India and United States. But in other countries like Bhutan, China, Finland, Germany, and Nigeria, the uh, the chart seems the the chart does not seems to be that affected by this period trend. Okay, thank you. That's all.